Hey, Russell here from Adelaide West Physio and Pilates. The question today is, how do you know if you're seeing the right physio, or how do you choose the right physio? And this is something that I've put a bit of thought into and actually created a document around this. But the summary of it is this. I would argue that there's no getting around experience and age and how long someone's been a physio for, because if you are more experienced, you've likely seen more variations on a particular problem. You've got more of a memory bank of similar patients in the past. But I don't think that has to always be the most important factor, because I've met a lot of young physios and worked with a lot of young physios who are super keen, super motivated, do lots of continuing education, and have experience beyond their years, almost like they're jamming many years of experience into 1 year. So experience may be important, and along with that is whether they have any extra qualifications like a master's or other certifications after having done their basic physio degree. Evidence of continuing education is really important, and I would say in some regards it's more important than something like a master's or a diploma, advanced diploma in something, because you want to be able to demonstrate that that you are not resting on your laurels either. So you want to see someone that is continuing to learn, evolve. You know, the knowledge base is so much bigger now than what it was 10 years ago, or 5 years ago for that matter. So I think an evidence of continuing education and willingness to learn is really important too. And that's going to be evident when you see someone and you ask a couple of questions. And it's quite okay to ask, so what level of evidence is there behind what you're proposing that we do? It's a really interesting way of finding whether someone actually knows what they're on about or not. I think if you're seeing someone for a particular problem, particularly if it's a long-standing problem, you want to see someone that's, we can't use the word expert, I suppose, or specialist unless you have that particular training, but you want to see someone that is really knowledgeable and quite experienced in a particular area. So if you're talking about migraines or headache, you want to see someone that's done a lot of work in the migraine headache space. If you want to see someone for an ongoing pain problem, you want to see someone that's done a lot of work in the persistent pain space. So a level of expertise in that area is important. The things when you actually are with a physio that are a good sign is their ability to listen, whether they're a good listener or not, whether you feel like you're being rushed out the door, or whether they're giving you a chance to tell your story, and they're doing it in a way that encourages you to feel comfortable with them, really. I think establishing that rapport is really important. And I think some health professionals value that more highly than others. So establishing a rapport with your health professional, I believe, is really important if you want to have what they call a therapeutic alliance, if you want to be a good team, really. Another thing I'd argue is really important is the time, knowing what amount of time is put aside for each appointment. The days are gone where 15-minute appointment slots are okay. There was a time where, believe it or not, 15 minutes was a fairly stock standard appointment time in a physio practice, and that just doesn't cut it anymore, because we know that you've got to talk to people. You've got to actually communicate with them. If you're talking about deep topics, you can't do that in 30 seconds. So we really value the length of time that we have to be with people, and I think more and more practices are following that kind of line, where appointments, instead of 15 or 20 minutes, they're 30 minutes. It gives you time to explore and to talk and to to treat as well. And so the other thing that I would argue is really important, particularly these days with the body of knowledge that we have behind us now, is being able to explain pain and being able to explain how pain works and how it fits with the problem that you're presenting with. So no longer is it enough to be talking about everything with a purely biomechanical or a purely pathoanatomical kind of model. We know now, without a doubt, pain is much more than just that, than just biomechanics. The physio that you see has to be conversant in pain science and pain education. I really strongly believe that. And the other thing I think that is, or two more things. One thing is they need to be able to give you a really good plan for self-management and the way that you can manage yourself, moving away from a therapist reliance situation, where once again traditionally it probably has been more like that in physiotherapy, less and less now, and the evidence is pretty clear that self-efficacy is really important. There are other health professions that are very therapist reliant, and that really flies in the face of the current evidence. So you want to see someone that is giving you tools, that's giving you ideas about how to manage yourself, exercises to do, stretches you can do, things that put you back in the driver's seat and back in control. And the last thing I want to mention too is you want to see someone that's giving you a clear plan of a clear summary of what they think is going on, a clear idea of how long it's going to take to get better, a clear idea of the things that they're going to do to contribute to that recovery, and also the things that you as a client can do to contribute to your recovery as well. So a really clear plan of attack, and one that's being updated session by session and almost preempting what the next step is, to show that there is a plan of attack, that it isn't just a routine come back for more treatment and more treatment and more treatment, because that's old school. Now it's about, okay, this is our next goal, this is what we're working towards, this is how we're going to do it, and upgrading it as you go along. So I hope that makes sense. If you're looking for a physio, if you're looking for a health professional, these are the things that I'd recommend to think about. In the description, I'll put a link to a document that I created that has all of these points and a few more really fleshed out to give you a good basis, a sound basis for making a choice of a health professional for you. Cheers.